Welcome everybody, thanks for tuning in. In this video I want to talk a little bit about our company Syzygy, about our philosophy, how do we came up with the whole concept, and especially I think most important for you, what are we going to offer? First of all, let me tell you that it all started with a big question mark. It all started basically with us not having answers, having too many open questions, especially in our field of health, where we deal with movement, where we deal with pain, where we deal with structural integration. All of these open questions led up to the point where we had to rethink established belief system, because it didn't work the way we were told it's supposed to work. We didn't reach the results that we were supposed to have, or that we thought we will have if we apply this certain principle. So this rethinking process of basically questioning everything that we ever been told, what we ever learned, and not just in the field of health, also in society, everything that shapes us, everything that's the environmental aspect of it, made us to integrate stuff that worked. So from all different fields. So it's not like if I'm doing a treatment, I just look at this certain belief system in this treatment. If I do training, I only do this certain training for this certain age, and for this age I'm going to do this. So we try to integrate and bring together everything that worked practically in our everyday work. So if something worked, we took it in. And we try to form it to a bigger concept of basically bringing you the best of diagnosing people, which means I can't work if I don't know what the problem is. There's a million techniques in all the different fields. There is chiropractic, there's osteopathy, there's physical therapy, there's needling, and so on and so on. There's all these different forms of rehab training systems, starting from yoga, Pilates, over to functional training or weightlifting. So we try to bring together what worked best. So we try to give you only the essence of all of these concepts that we had experience with and that seemed to work. But first I need to identify the problem. So the first big part of what we try to offer you is finding the area where we have to attack. Then the next step is get the best techniques to reach your result. So if I want to get fibers that are shortened, lengthened, what is an appropriate good technique to go that way? And then once you achieve that goal, how do I make sure that this stays the way it is, and that the person that you were treating is not going to suffer from the same problem again? So this is when the movement comes into place. So we try to bring together all these three concepts. And I tell you right now, we didn't invent the wheel new. We integrated new techniques that were just a result of our experiences from other techniques that seem to work a little bit, and others that seem to work a little bit, but if we bring them together, it seemed to be like a really efficient tool. So what we try to give you is a concept from beginning to end. So from the moment the client walks in, until the moment, hopefully, when the client walks out of your door and hopefully not coming back to get treatment, at least. So this is also our philosophy. We question, we rethink, and we integrate. And this is what we try to also teach you in the courses that we are going to offer. Always question, because the things that we might teach you that are new to you would be just the basis of you questioning again the belief system, and then integrating what you maybe learned from us and what your prior experiences were. If you are a doctor, a physical therapist, or a personal trainer. So we want you to integrate. We don't try to give you, this is the way you have to do it. We basically collected together what seems to work, and we gave you the filtered end product of it. Speaking of the end product, we will be offering our concept in the form of courses, seminars. There will be a couple seminars where we gradually teach you how to assess with the most efficient assessment tools, your eyes, your hands, things that you have with you all the time. Then we're gonna give you a specialized assessment for certain areas, if there is a certain problem, integrated assessment, how do we look at the whole body. The same thing goes for structural integration. When we do treatment, we try to give you techniques that fix a local problem pretty efficiently, and then techniques which integrate with the other systems. And as the last step of it, we try to give you corrective exercises where we do neuromuscular associations, because we believe in the success to pain-free movement and efficient movement is not the amount of muscle you have, or is not the genetic predisposition that might be good in you or not so good in you. It's about the connection from the brain, the programmer, the computer, the boss, to the muscles, the workers, the executing organ of your body. And the most important thing is that we make the right connections, because this is again what we found is kind of a little bit missing. That we have a lot of concepts and teach you how to train that muscle. There is a lot of science about how to get more growth or more condition or more strength or more lengthening. But what we try to give you is the right connection. How do I form a connection between the right side of my brain and my left arm muscle that needs to work whenever I activate it? The open questions that we had, basically very simple. It was questions from everyday life. From our perspective, it was never anybody could answer the question. It's simply, why do we have unilateral differences when it comes to a simple process like wearing out, like arthrosis? Why do we have people that have arthrosis on the left, they have a painful left knee, but the right knee never hurts? Whenever they go running, the left knee hurts, it's not the right one. And they have arthrosis on the left cartilage side, not on the right. So how is that possible if I take one step after the other? It's not the aging process, because your legs are actually twins. They came out of your mother's womb at the same day. You take a step with the right, you take a step with the left. If you go jogging and you do 20,000 steps, it's usually 10,000 with the right and 10,000 with the left. So how does it come that we have these unilateral differences? These are open questions that again led us to rethink. Okay, what's the actual, really the cause of arthrosis, of wearing out? Is it just age? Is it just the pressure, the usage of it, or is there maybe something else that is not being considered by the standard concept? This is when the part biomechanics came in, and this is where we found that the mechanics of the muscles are very important to the wearing out process. And what's the biomechanics? The biomechanics means that somebody's programming these mechanics. So it's not just the muscle that does the mechanics of the bones. The muscle gets the order, gets the information from the brain, which is also, again, needed to be trained, needed to be associated, or maybe other things need to be disassociated. So we also brought a program for you at home, in case you're not a health professional who wants to do seminars with us. We're also going to be offering an online course where we step by step try to lead you down that path of becoming pain-free, of becoming an efficient mover, and also of sustainable body usage. Because some of you might be 30 years old sitting here, and what arthrosis? I'm not bothered by arthrosis, I'm 30 years old. But you will be in 20 years, in 10 years, in 30 years. And the process of reversing that, stopping that, starts now, not in 40, 50 years. You can still work on it, but it's much harder work once you have that arthrosis, once you have less cartilage tissue. It's even harder work. So for all of the people that want to do preventive stuff, or you already suffer from a pain, we can give you a specialized home program where we're going to assess you and then give you the right myofascial release techniques, again the structural integration, and the corrective movements. The assessment will be done by us, because if you are home alone, you can't assess yourself. There is not a doctor around you, and even if you are a doctor or are a physical therapist, it's hard to assess yourself. So the part of assessment is going to be done by us, and then you will get the corrective exercises to fix that problem. We will be also covering you with products. Again, these products emerged out of the need of having open questions about why does a chair look actually like it looks, and why does everybody sitting on a chair has problems? There's got to be something that might be corrective about that chair. or other tools that you're going to use in everyday life, which are not optimally designed to give you a pain-free or a corrective purpose to it. So stay tuned and you will see what will be coming at you.